Hello, today we're going to talk about health information exchange using the KONZA platform. KONZA is a national health information exchange developed by the Kansas Health Information Network. KHIN, the Kansas Health Information Network, was started by the Kansas State Medical Society, and from there expanded across the country. Today, KONZA operates health information exchange in multiple states with partnership arrangements, management arrangements, and working directly with physicians, hospitals, and in clinically integrated networks. KONZA is ENAC accredited, so we have the highest standard of accreditation that you can receive as a health information exchange for our security in our exchange. We were established in 2010, and we are a nonprofit health information exchange. The health information exchange is developed and can be utilized really to help physicians and other clinicians at the point of care. It can assist by sharing data back with the clinically integrated network to use their own population health management analytics and reporting. The clinical data shared within the health information exchange can be shared back to payers for HEDIS. And then also it can be shared back to the patients so they know all of their data from all the disparate sources throughout the healthcare system. The way that health information exchange works and the way that it operates, if you think about it from the patient's point of view, is the patient visits a primary care physician, a specialist, a hospital, and everybody is on different electronic medical records. And all of the data from the separate medical records are all siloed. What the health information exchange does is it pulls that data out of the electronic medical record, stores it there in an enterprise data warehouse, and allows the clinicians to view this data in many different ways. You can log into a health information exchange portal, so you can see your patient's longitudinal patient record from all the different data sources that have contributed to their medical record. We can actually send this data back into your electronic medical record, so you're able to see your patient's record from all the different sources back within your own medical record and have the ability to import things such as medications, allergies, and problems. Having the centralized data also allows you to run clinical quality analytics and population health management analytics out of the data that's in your exchange, and also allows us to do some other great things such as event notification alerting. So you can know in real time when your patients show up in an emergency room or are admitted to the hospital or discharged from the hospital. Given KONZA's scale and given our experience and how we really specialize in working with independent physician practices, we have seen so many different instances of ambulatory electronic medical records and really have expertise in most of them. This slide is not meant to be all inclusive of all the names of all the different electronic medical records that we have worked with. Most major electronic medical records that are out there, and even have national hubs built with some of the more popular ones such as Athena, eClinicalWorks, Greenway, NetSmart, and Practice Fusion. This is a screenshot of our health information exchange portal. So this is just a website that you would log into with your unique credentials. Once you are in there, you could search for your patient just as you would searching them in an electronic medical record. What you're going to see here is basically like a view-only electronic medical record fed by multiple sources of data. So we're going to actually take all those different documents that we receive on a patient and all the different messages we receive on a patient, and we're going to combine all of those into one document for you that's easy to use, where you don't have to click through multiple things to find the information you need. We consolidate all these different data sources into one document for you. We call it the consolidated CDA. So that way all your medications are together, all your allergies, all your problems, and they have been normalized and deduplicated so you don't get an unruly document. And as I mentioned earlier, we can also do that bi-directional data feed where you're actually able to see the data in the health information exchange from your own electronic medical record. Here's a screenshot of Greenway, and then Athena showing how you can pull down that information from within your own EMR. The way the KONZA HIE is set up is really we bring in data from lots of different sources, whether it be from other health information exchanges, unidirectional data feeds coming into the HIE, bidirectional data feeds. We run those through our integration engine, and from there, that's how we do things like produce that consolidated CDA for the physicians, or send that data to our data warehouse to produce our analytics. So one of the things that we do provide to our physician participants is logins to our HQ Insights product. So this is our clinical dashboards. The data that you will see in here will be is coming from the Health Information Exchange. It's fed off the Health Information Exchange. And when you log into this, you will see these dashboard tiles on your patients. So if you wanted to know your patients with 3 or more chronic conditions that have also had 5 or more emergency room visits in the past 12 months, you could click into our high-risk patients tile. Or if you wanted to see how you were doing on your CMS G-Pro quality measures, you could click into our ACO metrics tile. If you wanted to see those real-time alerts of patients that have shown up in an emergency room or been admitted to the hospital, been discharged from the hospital, you can click into that acute alerts tile. So when you click into one of our tiles, if you click into our quality measures tile, what you're going to see is a dashboard that looks like this, filled with bar graphs and numbers and lots of great things. And anytime you see a visualization within our analytics, you can always click into it to drill down to get to that patient level data. And even when you are working with one of our tiles, such as acute alerts, where we're wanting to alert you in real time when patients have an event, that looks like a spreadsheet that populates in real time. And here the patient information is redacted. But anytime you get down to patient level data within our HQ Insights product, you can download this information into an Excel document. You could print it out as a PDF. So you can manipulate that yourself to have it how your practice needs it. If you're a part of a member of an ACO and do CMS reporting for your quality, KONZA does own its own qualified registry with CMS. And so it's called the Doctors Quality Reporting Network. We have our eCQMs certified by CMS to be able to report those for your quality. We can also run what's called a QRDA3 across our health information exchange for the patients that are attributed to your ACO to get more accurate quality reporting. So KONZA can also help with MIPS as well, especially with some of the new promoting interoperability measure for HIE bidirectional exchange. There's lots of different things that, by virtue of participating with the Health Information Exchange, that KONZA will be able to help with regards to MIPS, including your quality reporting. KONZA is also going through the NCQA DAV certification process, the Data Aggregator Validator Program. What this will mean is it will allow us to have NCQA certified data come from our Health Information Exchange and can be sent to payers. Why this is important for your practice is they will no longer have to do audits of your medical records for HEDIS purposes. Can automate this process by sending them data electronically through the Health Information Exchange that is considered NCQA certified standard supplemental data. And so we do have the ability to work with payers in this way, whether it be for HEDIS reporting or sharing them data extracts for the purposes of risk adjustment. We can automate a lot of these data feeds to your payers, especially if you are in a value-based contract that requires this type of data sharing. We can assist with that. We do also have a personal health record for patients. So this patient portal is really made for if your patients, if they want to see what data they have in the Health Information Exchange, they can access that through our patient portal. It also comes with direct secure messaging for the patients and a lot of other cool things, such as educational items. KONZA is a national exchange, and we have built out connections all across the country. And so some of these connections we have created through other health information exchanges. And so On these slides, you will see some of those national exchanges, some of those national connections that we have created. That concludes the presentation today. If you have any questions, please reach out to information@konza.org. Thank you.